Thank you all for being here. I'm really excited to get to present with Kamal and Stephanie today. This is a very special opportunity to showcase the work of one of our very impressive and important partner organizations in Nepal. In November, I had the opportunity to go on a couple site visits with Kamal to the far west region of Nepal in which RUWDUC works. And so I'm going to take kind of the first 10-15 minutes here to go through just some photos and share my itinerary with you. We're going to kind of do this collectively, Kamal and I. And then afterwards, Kamal is going to talk more extensively about our newly forged and expanded partnership together. So Stephanie's going to do my slides here. Yeah, perfect. Thank you. So in 2001, Population Connection and RUWDUC first made contact. We were in the process of looking at and investigating different organizations around the world, especially in Asia, that were working in sectors and on initiatives that were in line with our mission. RUWDUC came up and we quickly got in contact with Kamal Rawal, who again is the executive director, and forged a partnership. At that time, there was a really dire need for a early flood warning system. And so we initially sort of contributed to those efforts. And then this year, we've actually expanded our partnership to involve and help fund an entire project linking girls' education, reproductive health, and community-led leadership and empowerment training through one community called RUWDUC, which is where Kamal and I traveled together. Next slide, please. So Kamal is obviously going to go into more depth about RUWDUC, but just to give a really brief introduction, the Rural Women's Development and Unity Center works throughout Nepal, primarily in the far west region, which is one of the most marginalized areas in Nepal. It supports rural development programs and things like women's empowerment, environmental conservation, economic opportunity, healthcare, and climate adaptation. RUWDUC actually works very closely with the Nepali government and designs policies and programs that are eventually sort of taken over just in terms of funding and maintenance by local and regional governments. In this way, this ensures kind of project longevity and sustainability. Also, you'll see in the bottom picture here, Dr. Arza. Kamal, what's her full name? Dr. Arza.
Dr. Arzu Rana Deuba.
Yes, this is the board of RUWDUC, including Kamal there on the far left. And Dr. Arza is actually the Prime Minister's, or she's the First Lady. So she's the Prime Minister's wife of Nepal. So we got to go into Kathmandu on the very first day of the trip and meet with her. She's a very impressive lady. She again works on the board of RUWDUC, but also on a wide variety of community development and social justice issues throughout Nepal. So RUWDUC works very closely with her and with the larger government to ensure project sustainability and to, sort of garner more support and funding for development. Next slide. All right, so I'm just going to go through the itinerary here. Kamal, we can kind of do this collectively as well. Kamal set up a really amazing itinerary for me and for him to perform together. We first started in Kathmandu, which is the capital city of Nepal. There we met with the RUWDUC board, which you just saw a picture of, including the Prime Minister's wife, the First Lady, at the Prime Minister's office, which is a very amazing and interesting experience. I'm very honored to have been able to do that. We then flew to a town called Dangadi and met there with two Tharu communities. These communities represent, I think, Kamal, the most marginalized communities in Nepal, and they represent the lowest class, the Dalist caste In Nepal, there are caste systems which relate to sort of socioeconomic status and overall opportunity, I think, within the country. We also assessed flood risk areas, met with local officials, and toured a couple different newly renovated houses that have been done so on behalf of RUWDUC. Go ahead, Kamal.
Yeah, and then the houses that were built were during the COVID-19 period. The migrant workers returning from India were badly hit by the because they didn't get the job during the COVID-19, and they didn't have any good proper house to stay in here there. So RUWDUC, with the support from Penwood Foundation USA, we constructed around 15 houses, and we resettled 15 families, and we plan to resettle more 50 families in over there in that area. So thank you. Over to you, Hannah.
Yeah, amazing, beautiful. And we'll get into the details of that in a couple slides. But from there, we drove 5 hours into the mountains, into a community called RUWDUC. This is located right below the Api Saipal region of the Himalayas. So it's really mountainous and a really high elevation, and just a beautiful community that's also at risk and in need of help. So this is another community that RUWDUC works very closely with and in. And then from there, we traveled back by car to Dangadi and then to Kathmandu.
Next slide, please, Stephanie.
Yeah, next slide. All right, so day one, we went from Kathmandu to Dangadi, which is about a 1.5 hour plane ride, right, Kamal?
Yeah.
Pretty easy, straight shot. There we met with RUWDUC staff. So we had lunch together, as you can see in the right-hand side photo. Then we toured a border town and met with one of the ward presidents, who RUWDUC works very closely with, and a guy named Raj Iyer. And from there, we traveled to 2 different Tharu communities in which RUWDUC works. And as Kamal sort of alluded to, these initiatives in Dangadi focus a lot on home fortification, things like flood prevention and other relief efforts, as well as economic empowerment. And from there, we went to RUWDUC, and we drove up into the mountains. Next, please. And so this is a video of us flying into Dangadi. And I remember, Kamal, whenever we were landing, and actually on the whole way there, we were looking at the mountains. On the far right, you can see a picture that I snapped just from the window of the plane. And you said that it looks like the hills are bleeding. I have a little arrow there in white from kind of an example of like why he said that, but that's sort of the landscape and what it looks like throughout the entire plane ride. And Kamal, do you want to expand a little bit on why you said that and what that means?
Yeah, and the development model of Nepal now, it has become like cutting the trees and making the roads, and people only think that making the roads is only the part of the infrastructure development, but it has been affecting and bringing the landslides and floods in that area as well. So a lot of hills are bleeding, and it is getting deforestation as well. So it has an adverse effect on the land area as well.
Yes, and so Dangadi is located right at the bottom of not only the Himalayas, but all of these mountains in between, which is where Dangari is located. But so all of this all of these unsustainable building practices are really causing a lot of problems for the lower land, flatland regions, which are increasingly subject to flooding, to landslides, and other sort of environmental issues. Okay, next slide, please. So these are a couple of pictures of the communities in which we toured. The first on the left-hand side is an example of roof restoration and home fortification that has been funded by RUWDUC, and is an initiative that, again, fortifies houses in the wake of and sort of prevents increased damage from things like flooding or, you know, like a lot of water events, right? On the bottom left, we've got economic development initiatives. So there's one community member, and Kamal, you can expand a little bit on this, but she was essentially given a house with the funding by RUWDUC, and then also an opportunity to begin making shoes as a way to sustain her livelihood, right?
Yeah, and these days she's selling shoes 5 to 6 pieces every day, which is supported for her economic empowerment, and it will certainly sustain her life in future as well. Before that, she didn't have a proper house to stay in, and the COVID-19 has badly struck her. So she started. So after the construction of the new house with the support from RUWDUC, now she has been able to make shoes, and she has been able to sell in the markets as well. Yeah, Anna.
Right. And then on the right-hand side, there's just more examples of safe housing initiatives and building practices that have been aided by RUWDUC. Yes, next slide, please. And this is just a quote that I took from Ramesh Chand, who was the board member of RUWDUC Dangadi, and he works in the Far West region. We had lunch together at the very beginning whenever we first flew in, and he said that he was, working for a long time in the finance industry and liked it, but once he, became aligned with RUWDUC, just found a new purpose in life, and just felt way more fulfilled and way more sort of engaged in life. He says, "I like this type of work. It makes me feel so good to help the neediest people." And we got to, again, tour this woman's house, and she was honestly just the sweetest, most kindest, down to earth, and just grateful human being. It's really beautiful to see people like this become empowered and feel like they have more opportunity in life. Next slide, please. All right, so day 2, we drove all the way into the mountains, again, about 5 hours, which was one of the most beautiful experiences of my entire life. I don't know if the video is working too well, but I included one there just so you can see really, really amazing topography and landscapes, and just an overall beautiful energy and feel. It's really difficult to describe, but it's very powerful. Once we arrived in RUWDUC and spent the night, we toured the hospital in the morning, the main hospital there, and visited a nutrition rehabilitation home, which is focused on aiding malnutrition. So a lot of women and their children come into this rehabilitation home for the purposes of recovering from severe malnutrition that they've experienced through poverty. Then we went to the secondary school, Mahendra Secondary School, met with the head teacher, met with a couple classrooms, and talked through some of the issues that students are facing within their communities, at home and in school. And then we looked at goals for the future. And then finally, we attended the Women's Empowerment meeting at the RUWDUC office. This is a bi-weekly meeting that's hosted entirely by women who reside in the community and who are interested in becoming leaders and becoming more empowered as decision makers, which is also a really amazing and powerful experience that RUWDUC has spearheaded. Next slide, please. So these are pictures of this, and I wanted to just allow you, Kamal, to talk about the meeting that was held at the Mahendra Secondary School regarding the Chandari practice. This is something.
Practice.
Sorry.
It is called Chhaupadi practice, which is a bad superstition in far west part of Nepal. What happens when the meaning of Chhaupadi is the girls have to stay away from their parents in another room. They are not allowed to touch during the menstruation period. They are not allowed to drink cow's milk, and buffalo's meal, because there is a superstition that if they eat that meal, then the cows and buffaloes will stop giving the milk. They will not be able to enter in the kitchen. They will be given separate food, and one thing is that due to the low economic condition, they don't get good sanitary pads to use, so then they don't go to their schools for 4 to 5 days. So and one of the main reason for malnutrition of the children in later ages is the due to the lack of diets during the menstruation period. And there is a place called Cham district in Nepal, and where the girls are kept in cow sheds during the menstruation period, and they are forced to stay over there. Not only the girls, but the mothers, sisters, whoever get menstruation during that period, they have to stay over there. So it is a bad superstition, but it is slowly decreasing slowly, and we hope that it will decrease. It will completely vanish within few years. Yeah, Anna.
Yes, thank you. Yes, so as you can see, we met with an entire group of girls who ranged in age about 13 to 15. And as they were talking about the challenges that they're facing within their communities, one of them was just getting adequate access to menstrual hygiene and care. And it's much deeper than just the surface sort of levels of that, right? There's all of these sort of cultural aspects of menstrual cycles that prevent girls from going to school. It's very customary, as Kamal said, for girls to be, kind of secluded from their houses. They oftentimes have to sleep in sheds, which has ended up in deaths, right? Because people are being killed in the night from snake bites. They're not allowed to eat meat. They're not allowed to be touched. It's a very, very difficult and oppressive, I think, cultural issue. And Kamal would agree with that, right?
Yeah, not only cultural, but also religious issue as well, because priests think that the girls should not enter and pass from the temple ways. If there is a temple in between the roads, then the girls have to totally avoid that road and go from another road, taking longer time. So they don't have to, they can't walk from the way where the temple is over there.
Yes, yes. So this is, keep this in mind, because this is one of the things that we're going to be working on together, Population Connection and RUWDUC. And the top right, just quickly, we had the Women's Empowerment meeting. And I just wanted to make note of the fact that this is a really impressive thing to see as well in this community, which is developing and has a lot of sort of patriarchal cultural sort of foundations. Women have been able to kind of confront the dominant narratives that say that they need only to be at home, cooking, cleaning, and doing things around the house, to come to these meetings and work together to figure out ways to, address needs in their communities. Some people are using the empowerment meetings as a way to eventually become involved in politics, and then just overall are becoming more leaders in their communities, which is really, really impressive to see, very inspiring. All right, next slide, please. I'm going to try not to take too long here. And then these are just other pictures from that same day. The upper left-hand corner is the school, and Kamal, this is the school that you went to, right? For secondary.
Yes, yeah. I studied there for 12 years, and I was also a teacher over there for 3 to 4 years.
Amazing. Yes. So another great aspect of RUWDUC's work is that a lot of the employees of RUWDUC, most of them actually are from the communities in which they work. So Kamal is from RUWDUC and has many years of experience working in schools and working in the community as well. So So again, yeah, these are just photos from that same day. On the far right bottom, you see the women's group that met and was talking about their goals for the future. Next. All right, so day 3, which is the last day that we had together before traveling back to Kathmandu. The first thing we did was to tour the Mahakali Primary School. So we drove to a different area in that same region, one that was located more in the floodplain regions, right, Kamal? The flatter areas. And these communities represent an even lower class, like the Dalit class, which is the very lowest of the caste systems and the most marginalized. So we attended a ceremony there for students who were given new uniforms on behalf of RUWDUC and Dr. Arza, who funded the entire initiative. We then got to tour the early warning system, the flood early warning system, which was really interesting. And I'll take a few minutes to explain that as well in the next slide. And then finally, we attended one more women's empowerment meeting at the Mahakali Basin communities and listened to the group discuss, again, sort of issues within their communities and the goals that they have for the future. All right, so these are just pictures again from that day. The women's empowerment meeting is in the upper left-hand corner. The Mahakali Primary School just below that. You can see that they've just received all of their uniforms and very proudly sporting them. Just to the right of that on the bottom is the school that they attend. It's one room, right? And it's right, Kamal, it's one room. And these are students that range in age from maybe about 6 to 10 or 12, right?
Yes.
Yeah.
And they all are from the Dalit communities, economically marginalized communities.
Yes. And this is a community that actually is right on the border between India and Nepal. So there's a lot of migration coming to and from these areas. A lot of people are going to India in search of work, and it's sort of contributed to further economic marginalization within these communities. And then on the very top right-hand corner is the early flood warning system. And you can't really see, but on that sign is a logo of Population Connection, because again, we helped fund this particular initiative. And if you go to the next slide, I will talk a little bit, and Kamal can too, just about how this flood system works. So this is a community-led early warning system. So in this community, there's like this massive river that's right at the bottom of a few large mountain ranges. So it's really suspect to flooding. Whenever there's a big rain events, flooding can occur really instantly within the time frame of like an hour. And this really puts a lot of people at risk and has been life-threatening for so many people who live at the bottoms of these rivers. So this early warning system allows a family member, you can see in the top right, there's a house there with the little like antenna. The early warning system sort of has a meter that goes down into the river. Once the river reaches a certain height, this house is notified, the family members are notified, and they're able to then send a mass text out to all of the community members that are downriver, allowing them to, if they're washing clothes or fishing or something, to get out and to get everybody else out to make sure that they're safe before the flood comes. Is that right, Kamal?
Yeah. I would like to add a point in it, Hannah. Yeah, and one more thing is that this has been a model project in Nepal, and other NGOs have also been trying to replicate this early warning system, because it not only supports the community but also supports the local disaster management community being led by the government, because it releases the information within a seconds, so that all the people from downstream communities from in Nepal as well as in India are safe from floods. and also and after the restoration of this community-based flood early warning system, no one has died in the downstream due to the flood. But that's it. Yeah, Hannah.
That's fantastic. That's really amazing to know how effective this has already been. Great. Next slide, please.
And can I add a point, Hannah? And
Please,
this has been
you
the
can
link
on this slide.
Yeah,
Go ahead.
and the link has been added with the Department of Hydrology and Meteorology of the Government of Nepal, so that the Government of Nepal owns it and for the sustainability of the early warning system. Yeah, thank you, Anna.
Perfect. Thank you so much. So yeah, I just have a couple more slides with photos essentially. So this is obviously at the school, and I want to just kind of quickly go through these. We'll have these available online, but just I want to make sure that we have enough time for Kamal to speak briefly about his section of the presentation. So go ahead. Next slide. Yeah, so perfect. Thank you so much. All right, Kamal, I'm going to turn it over to you now. So please let us know all of the details about our partnership and the project that has been started.
Thank you, Anna. And the Rural Women's Development and Unity Center, it was established in April 1995. And the main mission of the organization was for the unity for women empowerment, because the far west part of Nepal, the women are illiterate, and because they don't have the good knowledge of the what they are doing because of the illiteracy and also the backwardness, and they are economically marginalized. So RUWDUC started the campaign to support those women, to support those families, by empowering women, children, and youth to contribute in a holistic social economical status in Nepal. And we cover all the after the successful implementation of the projects in far west part, we also have been working in other provinces of Nepal, and we have some district chapters in other districts as well. And RUWDUC has been working in the sector of as I told earlier, we have been working not only in one approach, but in holistic approach, which should cover education, health, human rights, access to justice through community mediation, income generation activities, reproductive health, safe motherhood, and internal and external migration, and in climate change, DRR, women empowerment, disaster, violence against women and girls, child rights and protection, as well as in gender and social inclusion. And I'm going to present some of the achievements of RUWDUC and sector-wise. And in health, before 20 years, I think, 15 to 20 years back, there was a system that no any women used to do the operations of prolapse, uterine prolapse. They were not sent to the medicals by their husbands, because their husbands were in India for their work. And so RUWDUC scanned those women, and 58 women were treated for their uterine prolapse. And then RUWDUC also conducted eye camps where 1,914 people were directly benefited, and 2,378 people were directly benefited for the heart camp, health camp, ear camp. These all camps were free of cost, and those, if the cases were difficult, and those patients were brought to Kathmandu for their treatment, and all the costs were borne by the RUWDUC. And we also established the birthing center in Nepal. RUWDUC was the first organization in Nepal to establish the birthing center before it in 1998. Before 1998, there was no any birthing center. The women used to give the birth in their homes or in the hospitals, but not proper birthing center. And we started the trend of the birthing center in Nepal. And also, as Hannah told you earlier, we have started the nutrition rehabilitation homes, so that the children suffering from malnutrition are treated properly, so that they can restore with their health. Around 4,522 severely malnourished children and mothers have been restored, and they have been sent to their homes. And we have been also been giving the orientation, not only 1 day or 2 day orientation, but in phases and we follow with them, and we have been giving the orientation about them, about the HIV/AIDS, drugs addictions, user family planning, and 5,909 direct benefited from this event. And regarding the Safe Motherhood event, and we have been also supporting the women, the pregnant mothers who are economically marginalized by supporting with them income generation, also by supporting with the good food, and also supporting with their how to maintain the good hygiene during the pregnancy period. And 15,068 women have been benefited from it, and also the 8,767 girls have been benefited to who have received the iron folic acid during so that their good health restores. And we have coordinated with the doctors for it. And also 12,463 women have been marginalized women have been treated who are suffering different issues with the gynecology, means with the baby's problem. Sorry. And regarding the income generation, RUWDUC was the first organization in Nepal with the support from ICIMOD. We started the campaign of honey production in Nepal. Now, during our field visit also, I showed it to Hannah as well, that 400 farmers were trained. Now around 200 to 300 farmers are still working as a beekeeping farmers, and they have been earning around 2 to 3 million per year by selling the honey. And also have been and RUWDUC has also established the National Central Resource Nursery and ward level model kitchen garden and sanitary. And we also started with the sanitary pad production, engaging the women from the local communities by providing with the training, and also by maintaining the quality of that pads. And we also sold 3,000 pads, and the amount we received from the pads selling was sent to the children's home where the orphan children who have been studying. And 24 hectares land irrigation was successful with the RUWDUC's initiation. And we have also supported with the capacity building of farmers, and also by providing the homestay promotion, cultural tourism, and production of local materials, rafting promotion events as well. And also we have started with the climate change scope activities like drip water irrigation, forest plantation, alternative livelihoods, and also the collection centers for vegetables and fruits, so that the farmers can bring their vegetables and fruits in over there, and they need not to go carry their vegetables and fruits for 8 or 10 hours, that they can keep in that collection center, and they have to walk for 45 minutes. And the shopkeepers or the good vendors will come over there, and they collect the vegetables in a good price from there. And regarding climate change and disaster risk reduction, RUWDUC has also established trans-boundary early warning system, and also has been starting capacity building activities with the disaster-based reduction, and also supported in input seed supports during the dry season, and also multi-use system. And RUWDUC also started with the micro hydro system in Donaldura. There was no electricity in one village, where the families had to walk for 12 hours to reach to the another community for bringing the food. So RUWDUC established the electricity over there by providing the micro hydro project, and also different climate change workshops with the teachers and students have been conducted. And also regarding the first aid training and the construction of pit latrines in school-based health programs have also been constructed, and also 34 pit latrines were constructed in schools, and now they have been handed over to the schools, and the schools have been properly using it. And around 1,600 hectares land have been planted, have been done with the plantation in riverbank area. Regarding the education and youth project, RUWDUC has supported scholarship program for outstanding girls, and 18 girls for their education. Now they are doing 80 out of 18 girls, 80% of the girls are doing jobs in deputed places. Means those girls were brought from the economically marginalized families. Now they are doing they are doing good in the banks and also in the business offices and also and as a government officers. And RUWDUC provided 185 students with the scholarship. Also, RUWDUC has constructed girls hostel. We had monitored during the Hannah's visit as well. That hostel covers 80 girls. Then 80 girls can stay near over there because there's a trend in Far West regarding the child marriage. As Hannah told earlier, one big issue with the Far West is the chhaupadi practice, which I told you earlier, and second one is about the child marriage. Child marriage is really high in our part of the our part of the region due to the illiteracy or underdevelopment, economically marginalization, lack of due to the poverty as well. So to stop the child marriage, so we constructed hostels so that girls can stay over there free of cost. They don't have to pay any money for it, and they can continue their higher education. Now 80 girls are staying in over there, and they are doing their bachelor's level. And RUWDUC has supported 11,735 children from marginalized communities with the school bags, uniform, and stationery and sanitation items. And also RUWDUC has been supporting 15 conflict victim children for their, and they have been pursuing their secondary level education. And 478 youths are still engaged with RUWDUC as a volunteers. They are mobilized during the floods. They are demobilized during the landslides to disseminate the message during the early warning system, to collect the data of the students, and all these youths have been doing good work as a volunteers. And regarding the women empowerment and violence against women and girls, RUWDUC has formed 92 countering violence against women groups in our part of the region, and those groups have conducted different activities to orient other women about the violence against women and girls, what the law says, what should they do to get the access to justice, and also RUWDUC has been mobilizing the female community health volunteers for women's and children's health, because most of the men migrate to India, but and the women and children are left in Nepal. So 114 female community health volunteers have been oriented about it. So, and also RUWDUC has provided strategic input to identifies issues related with the children's and women health. And so and similarly with it, 160 women members raising voice against gender-based violence, domestic violence, and other community issues through community mediation in Nepal. I'll just take 5 minutes. Will it be okay? Okay, Hannah? 5 to 7 minutes?
Yeah, go ahead. Thank you.
Yeah, and I would also like to inform you that RUWDUC was the pioneer organization in Nepal to bring in the community mediation in Nepal. And the community mediation's mission is to bring the disputes result in win-win situation, because there are small issues in the communities which hampers the access to justice. For example, there might be the issues of the land, there might be issues of the border between two houses. So small issues have been sorted out by or mediated by the trained mediators, and we have resolved around 10,685 cases in win-win situation. It means both the parties are happy with the decision made by themselves, and our 633 mediators were trained from RUWDUC, and they have resolved those cases in 56 community mediation service centers. And RUWDUC has also formed youth groups to ensure the human rights and peace building activities. And RUWDUC has also provided elected representatives about the peace building and dispute resolution. And during the COVID-19, RUWDUC supported 11,000 migrant workers entering from Srinagar border, India, with the free food and water support, and also provided 300 PPE sets and other personal hygiene kits to hospitals, and also provided fans, water filters, and foods and sanitation support. Mostly the food and sanitation support was provided to the pregnant mothers who didn't get the proper food during the COVID-19 period. So we went into their homes, taking the risks of our own life during the COVID-19. We made 1,035 families and made 1,035 pregnant mothers, and we provided ration for 3 to 4 months for each family, and also supported quarantines and by providing sanitation items in the quarantines, and also provided counseling about what should be done during the COVID-19. We conducted phone line service, which was free of cost. We coordinated with the government of Nepal, and also provided oxygen containers because it was so necessary during that period. And also Dr. Arju Rana Deuba, as Hannah told earlier, she supported 10 lakhs in Nepali, in English, 10 million with for establishing the oxygen plant in Kailali district. And also RUWDUC started with the hand washing stations, because in the remote places most of the people got COVID-19 during by not following the proper health hygiene rules, and also supported by providing 45 wheelchairs to the physically disabled people in those area. So let me check with the last one. RUWDUC successes, I will just take 2 minutes now. RUWDUC successes, we have disaggregated in two parts: in policy level and in community level. Inclusion of community mediation in Local Governance Act 2074 means it is in Bikram Sambat, which is Nepali date. Means RUWDUC brought in the community mediation in Nepal as a pioneer organization. For 15 years, the community mediation program went in through the NGOs. Now, the government has owned it and has taken it and adopted in the Local Governance Act. Now, RUWDUC, which and in that RUWDUC played a lead role. And similarly, women empowerment work procedure was endorsed from the provincial government. Our women empowerment centers lobbied for it, and it says that all the local government from all districts have to allocate some budget for women empowerment activities, mandatory. So it was one of the initiation of RUWDUC. And 6 points Dangadi declaration. There was a declaration made in Dangadi. It is a district in Nepal, and it says that all the local government mandatorily should allocate budget for the women and youth and children residing in basin area who have been suffering from flood, landslide, drought, fire. And so they have allocated budget, and around 20 million budget was allocated from the local government in climate change, women empowerment activities, disaster risk reduction, irrigation, and drinking water. Similarly, sand and sanitation guideline was also endorsed from the government of Nepal through the initiation of RUWDUC. And also transboundary rafting and tourist packages for private sector development was also initiated from RUWDUC. Similarly, in community level activities, these are some of the community level activities which I have already told you in the previous part as well. So, and initiations through population connections, ration and warm clothes during the flood in 2020-21. 32 houses were totally demolished by the flood. They didn't know where to stay in. They didn't have proper food. They didn't have proper clothes to wear. So population connection supported with the ration and warm clothes. Now the government is constructing their houses, and they will surely reside in their new houses. Similarly, telemetric community-based flood early warning system was also reestablished with the support from population connection, which was earlier established by ICIMOD. And in the left side corner, you can see the logo of Government of Nepal, RUWDUC, ICIMOD, population connection, and Oxfam, because Oxfam also supported in bringing that link, that what we call that digital link in the website. And also the population connection has also been supporting to be strengthening the Women Empowerment Center in the right side photo. And the last one is now RUWDUC and Population Connection has planned to continue with the Girls Empowerment Project, which Hannah has already told. It will mainly focus on bringing about the changes in the health and the behavior of the girls and the families and the guardians for a safe life for girls and women in far west region, because they've been suffering a lot. There are some photos of the RUWDUC's projects, and this left one is about the discussion of planning, and the second one is about the opening inauguration of the girls hostel. Some of the this left one is about the cash support and uniform and stationery provided to the students, and the right one side is about the leadership training to the selected women from the communities. And the right side is about the setting up the telemetry community-based flood early warning system. Yes, thank you for your patience.
All right, thank you so much, Kamal. It was
I'm
that
so
was
sorry
very
because
interesting. Yeah.
I took a bit time, more
Oh
time.
no, that's okay. It's really important for us to get to know RUWDUC and everything that you guys are doing, and you're doing a lot. So thank you for taking the time to explain in such depth all of the different programs and initiatives being run by this organization. Really inspiring. We don't have too much time left, but there are just a few questions in the chat here that I wanted to address. And Kamal, there's some interest here just about the disparity that exists between boys and girls in school. So I'm not sure if you know this offhand, but maybe you could speak more anecdotally about the sort of the issues of gender equality as they play out in education. So for example, what is the percentage of girls versus boys who are going to school and graduation rates, and how does that differ, in urban versus rural areas and in the far west region in particular?
May I take this question, Hannah? And
Please do.
thank you, Karen, for bringing this issue. And what has been seen in our part of Nepal is the boys are sent to the boarding schools, and girls, mostly girls, are sent to the government school where they don't have to pay anything. And then there is that gender injustice between son and daughter, and it is found that around 60% to 70% are girls in government schools, and around 30% to 40%, around 30 to 40% are boys in secondary school. Is there still the practice of menstrual period hurts? Yeah, it's still over there, because being the son from the far west part, I still know those places where there are horses. But the horse might be changed into sheds where the cows also live over there, but also the girls, mother and sisters also live over there. So there is still that practice. Regarding the support from USAID, yeah, we got the support from USAID during the Pahal project, which was for the income generation activities. Yeah, and it also supported the women farmers. But nowadays there is no any support from USAID. We have tried to apply in other projects as well. And regarding the percentage of girls who completed secondary education, I have to check it out, Kate. I will try my best to share this information. I will send it via Hannah. Will it be okay, Hannah?
Sure. I was just looking online, and I need to fact check this because I just did a quick search, but it looks like about 63% of girls are enrolled in secondary school. But I know, as you were saying, there's a difference between enrollment and then completion.
And there's a policy being made, being formed a few years back, that no any girls or boys fail up to secondary level education, so that they can continue with their education. So the percentage might be increasing. I will check out the number from last year one, Hannah. And regarding the what percent of girls marry below the age of 18? It depends. It is mostly in economically marginalized families, mostly in the Dalit families. If I tell you that out of 100 Dalit girls, it has been found that sorry for the interruption.
That's okay.
It has been found that out of 100 girls, around 60 to 70 girls have been suffering from have done the child marriage, Hannah.
Wow. Wow,
And the fact regarding the factors, it is mostly about the poverty, lack of education, because their fathers don't stay over in there. They have to stay with their mothers. Fathers go to India for the work. Yeah, these are some of the factors.
Yeah, well, thank you so much. This has been so interesting. And again, I'm so honored to be able to get to know you more on a personal level, Kamal, and be more familiar with the work that RUWDUC is doing. You obviously span a lot of different sectors, and your initiatives are very comprehensive and community-led. So I think that the work you're doing here is very important, and I'm glad we've gotten the opportunity to talk to our members and donors more about your initiatives and our partnerships together. It is right on the hour, so I think we've completed for today. So thank you so much, everyone, for attending.